It's a big celebration for May Harrison, who's turning 105.
It's just a birthday to me. I don't feel any older. I just feel I'm having a birthday.
She has a lot of fond memories to reflect on, especially those with her late husband, William.
He was fantastic. I would just wish he was here today. We loved dancing, we loved travelling, we loved our family.
A few months ago, though, birthday celebrations were the last thing on May's mind. The now sprightly centenarian had COVID.
I was very sick, and when I came out of it, I was very, very weak, but I've got over it.
Others haven't been so lucky. COVID has devastated aged care nationally, with almost 2,500 deaths, people forced to isolate and a lack of social interaction. While there have been major safety improvements since the start of the pandemic, there are currently almost 800 active outbreaks in residential facilities alone.
What a milestone it is. All of our homes are being impacted by COVID still today, and in fact in 2022 we've seen the cases increase in our homes.
I appreciate this place, I love it.
Chris Marmorellis is the CEO of Widden Aged Care, where May lives. He thinks lax social settings outside the care home are driving the increase, and that's putting even more pressure on an already depleted workforce.
We're still seeing a huge impact on workforce. We're seeing a lot of staff that are having still to isolate, who are contracting COVID. We're not finding the backup staff that we need, they're just not there.
And now, beyond aged care, reinfections are on the rise. In New South Wales, more than 11,300 people have had COVID twice or more. And for nearly half of those people, both infections occurred after the Omicron variant emerged in November. In Victoria, there's been more than 20,000 reinfections. For South Australia, it's just over 1,700. In the Northern Territory, more than 220. That's out of more than 70,000 cases, the lowest figure in the country. And in the ACT, just over 580 people have been reinfected. 70% of those had both infections since the arrival of Omicron. In the Sydney lab, Associate Professor Stuart Turville and his team are trying to learn more about immunity and reinfection for the most at-risk people.
A lot of people that might have had mild or asymptomatic disease not having a very strong response. But the thing about it is what's left in terms of the antibodies is there's not a lot there, and they're going to wane faster over time.
It's not yet clear how many of us could face multiple COVID infections because not enough is known about the combination of immunity, vaccines and COVID.
It's changed the way it gets into our body, changed the way how it enters cells. We saw that in late 2021 in December. And we're really trying to understand is that how and why is it doing that?
The good news is vaccines have proven to be highly effective at reducing severe disease and hospitalisations for most people.
The vaccine is the key kind of, backbone of the immune response.
Expat Fenella O'Brien has had COVID twice.
The first time, it was pretty rough, pretty bad chest infection. I was out for the count.
Her second infection was the Delta strain and she struggled with fatigue.
I couldn't really get out of bed for so much long afterwards. I really struggled to get my energy back.
And as is typical of viruses, further evolution is possible. Since Omicron arrived, several subvariants have emerged. Early studies show they're adept at evading antibodies.
We don't know what this virus is going to do in the future if we let it evolve, right? So, yes, it has tricks up its sleeve.
But scientists are also working overtime to ensure they're ready. Penny Timms, ABC News.